Good evening, folks. This is Dr. Paul. Thank you very much for tuning to our channel this evening. Today, I want to talk about this tragic death of the first Ebola patient as being reported from Dallas in the United States. And sometimes, folks, things that look like fictional can happen in real life. Back when I was in medical school, I watched this movie Outbreak featuring Kevin Spacey, Morgan Freeman, Dustin Hoffman, these top stars. The film was about a fictional Ebola-like virus coming from Zaire in Africa to Cedar Creek, a fictional town created in Illinois in the United States. And the CDC and the Department of Defense, all of them, they fight to stop this virus. And it's a very interesting movie. I loved watching that movie. But while going home, some of my friends were saying, what a stupid movie this is. How come a virus from Zaire in Africa could go to a fictional town in Illinois? And they were just laughing. This is like stupid movie like that. But you see, 20 years after that, we are seeing that in real life. It became a reality. People are really getting the virus and they're coming here and propagating this virus. And Liberia, I have a soft spot for this country. And you remember, if you look into the history of the United States, we see the slavery being openly, publicly, legally practiced in this nation. Long before Civil War from 1861 to 65 and President Lincoln signing Emancipation Proclamation and all that, like long before, like in 1820s, like that. Some of the African Americans, they said there's no future for us in the United States. Let's go back to West Africa and start a country for our own. Let's build a nation for our own. And in 1847, they became the Republic of Liberia. And they constructed a capital, and they named the capital Monrovia after the 5th president of the United States who supported that colonization. So this is a nation with so many aspirations, built for the love of freedom, and by ex-slaves that left United States and went all the way to Africa to have their own nation. So this is a historical country. That's why it became one of the founding countries of United Nations when United Nations was formed after Second World War. So this country, it was developing. These American Africans or African Americans, they went back, but soon after they left, that elite class left, this country went back into civil wars, like almost 1 million people died. And now, on the top of those civil wars, the economic turmoil, now they are going through this devastating natural killer virus called Ebola. And now, this person, he has his own sad story. Now, he comes to Dallas, and let me, because I want to say a very important points in using this person's story. So he is the first person in the United States to die from this virus, and he went to Texas Health Presbyterian Hospital, and what they did have valuable lessons for all of us. So Thomas Eric Duncan, he died at 7:51 a.m. this morning, and he was going there the second time. He's a citizen of Liberia. He traveled from West Africa to Dallas. And you see, it's a very touching story. He was so happy to see his family, to be reunited with his son and his fiancée. And he came with so many dreams and aspirations to United States. And all of a sudden, the tragedy took him away. And now his body is being double bagged. And the orders from CDC were that he had to be either cremated or to be buried in a airtight casket. So you see how fragile human life could be, that a person who was traveling in an air flight now residing in a double bag because his body is highly contagious. Any secretions from that body are highly contagious. So life could be very, very fragile, and we never know when the final day comes to us. Now, coming to the reality, like useful to in clinical practice here. So this guy, Thomas Eric Duncan, I mean a very young guy, like just like 42 years old. So a very young guy, and he developed a few symptoms. And he went to Texas Health Presbyterian Hospital in Dallas. And the family, they found him. He was living with that family a few days. And then slowly he developed these symptoms. So you see, Ebola's incubation period is 2 to 21 days. So during his flight, he was okay. And then when he went back, everything started. I mean, we are wondering, like, there are like 5 people who got this virus. Some people survived. Dr. Kent Brantley, he survived. I'm going to meet him tomorrow. And I'm excited about that meeting. I'm going to talk to him. Kent Brantley, you saw in CNN that he was carried from Liberia in a special flight to Atlanta and was treated in Emory University Hospital. And this doctor, he has an amazing story. I'm going to share with you in my next video after meeting with him tomorrow. So there's a few survivors. That's good, thank God. This with prompt treatment, prompt attention, you can treat this disease. But let me talk a few minutes about this particular patient, Thomas Eric Duncan. So this guy was in Monrovia in Liberia. He was helping a pregnant woman a few days before he started to take his journey to the United States. So it's a heartbreaking story itself. That pregnant woman to whom he gave a ride, she also died. So he was helping a pregnant woman to get to a hospital in his taxi. And that pregnant woman, she was also vomiting. She went to the hospital in Liberia, and she was turned away. I mean, think about that. A pregnant woman was turned away because there was no place in the hospital to treat her. And there is 3,400 people dead. I am sure all of them, every one of them have stories like that, heart-rendering stories. So he was helping that lady, and probably he had no clue that he was already exposed to Ebola. And he took the flight and he came to the United States. And in the flight, probably he had no symptoms. And then he went to his family and developed symptoms and went to the emergency room in the Texas hospital. And in the middle of the night, with a fever of 100.1 degrees, he said he had abdominal pain for 2 days, a sharp headache with a decreased urination. And the hospital said, like, he did not report as nausea, vomiting, diarrhea. That's why we did not think he have Ebola. Now, that's a very important point to learn. Here is a guy coming from Liberia, and the hospital did not pay attention to that word. If the hospital had paid attention to that one word, this guy would have been alive today. But they gave him an antibiotic and sent him home. What for antibiotic? That's an important lesson, folks. When people come to us with a fever and headache, we say, take this antibiotic, shut up, go home, take Tylenol, ibuprofen, and sleep. That's it. Emergency rooms are doing that. And this is a problem all over the world, not just Texas hospital. We give an antibiotic just to keep these patients quiet. And that's a big problem. So you see, the history was not taken properly. And this patient actually said he is from Liberia. That should have set the alarms off. That should have raised the red flags. And immediately he should have been isolated and have been treated day by day. And had they paid attention to that one word, this patient would have been alive today. But that's not what happened. He was given an antibiotic and sent home. And the virus, it took a toll, and he went back. He was taken back to the ER again after a few days, and this time with abdominal pain and fever. Probably he was already bleeding at that time, because you see, this virus, it starts with all those non-specific symptoms, but like fever, nausea, vomiting, diarrhea, abdominal pain, skin rash, and then it becomes like a internal and external bleeding. That's when the death sentence is being written, when the hemorrhagic fever starts. And as I said, it has an incubation of 2 to 21 days. So in that incubation period, we may not realize, but then the symptoms start: sore throat, fever, abdominal pain, vomiting, diarrhea, rash, internal, external bleeding, and then the shock, then even the disseminated intravascular coagulation. Then that is too late. This virus has a tropism. It goes after these endothelial cells in the vasculature, and it wreaks havoc in the vascular endothelial cells. And the virus then spread into other organs like liver, spleen, lungs, kidneys, and it spreads so rapidly. And once it goes into all these organs, the mortality shoots up like 90%. So it's like its cousin, Marburg virus, is seen in monkeys. And this virus, actually this Ebola is not new. It started in 1976 in Sudan and Zaire, Democratic Republic of Congo. And ever since 1976, 38 years ago, it's made its appearance, and it's constantly showing up time to time. And now, even in 2003, it caused like 1,200 deaths. And it has different subtypes. And the most lethal one is the Zaire one. The Zaire and Congo variety. And it is the one that is causing Ebola hemorrhagic fever. Other countries like Uganda, Congo, Gabon, South Africa, and even countries like on the north to Uganda, like Sudan, is being affected. Maybe it may end up in Egypt and Israel. I am not sure, but that's a possibility, folks. So you see, I can say so many things, but let me cut it down since it's almost like 13 minutes now. I want to say the most important things we can learn from this is, number one, remember the incubation period, 2 to 21 days. So you need to observe patients for more than 21 days. Like people get exposed and after 2 days, if they say, I am fine, that's not enough. You need to watch them, observe them for 21 straight days before you say they are fine. That's number one. Number two, always remember to listen to where the patient is coming from. I always ask the patient, where are you from? I always ask that. Some people think, why does it matter where I am from? It matters. Sometimes it saves lives. And this patient told he is from Liberia, and that should have been raised the red flags in the hospital staff. And the hospital staff said, well, we missed it because our medical charts all mixed up. That's the problem. We have all these MRIs, CT scans, and electronic health records and all that. And you see, with all this technology, we sometimes lose to remember those simple things, those common sense things. And that one word, Liberia, should have alerted these people to isolate the patient and to start treatment to prevent the shock and hemorrhage. That would have saved his life, honestly. The third point is the misuse of antibiotics. Rather than treating this patient, they gave him an antibiotic. And the antibiotic, as you can see, is basically useless. And the useless use of antibiotics is something we need to think about. Not only we misdiagnose people, we waste a lot of valuable healthcare dollars. On the top of that, we also increase the resistance of these super bugs and add up to antibiotic resistance. And tomorrow also I'm going to talk about Ebola virus. Feel free to come back and subscribe to this channel if you like our videos. Thank you very much. Have a nice day.